sorry sa mga good afternoon, wala po ako naka-exam. Okay, next time na po. Okay, doon sa mga students na hindi pa naka-exam, okay, please inform the coordinator, but not today, but within this week, because you are given at least 10 days para mag-comply sa ating exam. Okay? So, yun siya. Maghatag na lang po ko list sa COOR sa inyong section sa katong mga wala pa naka-take og exam. Okay, so for now, we will just go over our new topic to discuss. Okay, we aligned our discussion today based on our syllabus. Okay, so supposed to be we will be discussing in continuation with antibiotics, but because of ASCO, we have to move forward. But hopefully by next week, we will continue with mga macrolides. Okay, just for today's discussion, we will be discussing about cardiovascular meds. Okay. So what is our objective for today's discussion? At the end of the lecture, you will be able to have an overview about the normal cardiovascular anatomy and physiology, to gain knowledge about the different medications to use, okay, in order to prevent certain cardiovascular related problems, be able to know the different uses of cardiovascular drugs, and to know the different medications, especially in the treatment of hypertension as one of the leading cardiovascular problems that we encounter, and to be able to gain knowledge with the health teachings and nursing consideration for nurses to perform and observe in every treatment. Okay. So let's discuss first what are the common medications that we use for cardiovascular diseases. So number one is our antihypertensive medications. So all of this will be discussed, but we will dwell more on for today's discussion about antihypertensive medications. So your antihypertensive medications, when we say of antihypertensive, automatic, that is the treatment that we use or medications that we use to treat for high blood pressure. Okay, so it seeks to prevent, antihypertensive medication seeks to prevent what? To prevent complications of high blood pressure, such as your stroke and your myocardial infarction. Okay? So, ano yung mga medications under antihypertensive medications? We have your ACE inhibitors, your angiotensin 2 receptor blockers, your calcium channel blockers, your vasodilators, as well as your sympatholytics. Okay, yun yung mga common natin na mga ginagamit for antihypertensive medications. While diuretics, when we say of diuretics, when we talk about diuretics, these are also known as our water pills. Okay, bakit siya water pills, ma'am? Because these medications are used or designed to what? To increase the amount of water and sodium that is expelled out of our body in the form of urine. Okay, so pampabawas siya ng tubig at asin sa ating katawan, kung sa sa layman's term. Okay, and they are commonly used for the treatment of high blood pressure. Okay, not just high blood pressure, but also they are used for patients who have congestive heart failure, as well as patients who have edema. Okay. So, ano yung ginagawa ng ating mga diuretics? Okay, they reduce the amount of fluid, okay, fluid in our blood vessels, and because of that, as a result, nagkakaroon tayo ng lower blood pressure. Okay. We also have medications such as anti-anginal. So, when we say anti-anginal, okay, these medications are used to provide immediate relief from the symptoms symptoms of angina attacks, or to prevent a particular patient to have angina. So ano pa yung angina, ma'am? Okay, when we say of angina, it means your chest pain. Okay, this discomfort is usually experienced by a certain individual, okay, whose heart muscle lacks oxygenated blood. Okay, so nagkakaroon ng angina ang isang tao if they have insufficient oxygenation. Okay, and then we also have antiarrhythmic medication. Mga antiarrhythmic medications natin. These medications prevent what? Prevent and treat, okay, heart rhythm problems. For example, your patient is experiencing atrial fibrillation, atrial flutter, mga ventricular tachycardia, and ventricular fibrillation. Ma'am, unsa na siya, ma'am? All of these are what? Tinatawag nating mga heart rhythm problems. And how you will know about this later on in your advanced nursing, you will be taught how to read ECG tracing. And all of this, yung mga sinabi kong mga atrial fibrillation, mga ganyan, this can be noted in your ECG tracing. Okay, it could be by 12 leads ECG. Okay, yung dikit-dikit sa heart, ay sa chest, yan siya. Okay, so yung mga antiarrhythmic drugs natin, okay, they also what? They try to correct, okay, the electrical system in our heart or in our cardiovascular, because it may be very quick, or it could be very slow, or there are what? Inconsistency with the rhythm of your heartbeat. Okay. We also have what we call cardiac glycosides. Okay, what are these cardiac glycosides, ma'am? These are medications that are what? Commonly derived from foxglove plants. Okay, so mga herbal. Okay, herbal such as your digitalis. Okay, so the common cardiac glycosides that we are using is what we call digoxin. Okay, and this digoxin, okay, or digoxin is used, okay, to our patients for treatment of atrial fibrillation and atrial flutter. Okay, ma'am, di ba naka-mention ka kaganina katong mga tawag ani kaning ang atong antiarrhythmic is also a treatment for kanang atrial fibrillation and atrial flutter? Yes, because there are certain medications that we give together. Okay, kasi nga, di ba, if you can still remember during our introduction, I have discussed to you about medications that we can combine. Okay, yun yung mga additives natin, mga additive medication na both sila, okay, same ng function, same ng effects, but we give them together to have a more efficient and effective result sa management ng ating patient. So, yun nga lang, not all patients can be administered in that way, kasi nga we have to consider also yung mga pre-existing condition ng ating patient. For example, our patients has kidney problems, so hindi natin sila pwede bigyan ng mga higher dosage or mga multiple dose medications kasi we don't want to add on the existing problem of our patients. Okay, so cardiac glycosides can also be used for patients who have chronic heart failure. Okay, when other medications fail na to have a result or better output with our patients. Okay, we also have medications such as anticoagulants. What are these anticoagulants, ma'am? These are also known as our blood thinners. Ma'am, unsay pasabot sa blood thinners, ma'am, kanang ginapanipis ang dugo? Dili pud siya ingon anak ka literal, ha? Okay, when we say of blood thinners, okay, what they actually do, these anticoagulants, is they try to interrupt, okay, our body's normal clotting factor, diba? for us normal individual, di ba, pag mga samad na, di ba, magkaroon dayon siya og mga kanang coagulation, di ba, maglapot-lapot na yan ato ang dugo. So pasabot ana, okay, naturally we have our, okay, you may go to the CR. Okay. Naturally we have our own clotting process. Okay, kaya ma-stop na to ang mga bleeding na atay mga kanang ma-prevent na to ang kanang signs o ay kanang possibility of having bleeding because our clotting factor is good. Okay, so with blood thinners, iyahang i-disrupt lang ang tawag ani ang normal na clotting factor nato para dili ta magkaroon og kanang mga thrombus formations. Okay, so we also have thrombolytics. Okay, what do you mean by thrombolytics, ma'am? These are medications used to dissolve a blood clot. For example, okay, a patient who has DVT, okay, deep vein thrombosis, naa na siya kanang clot, okay, sa ihang blood vessel. So doctors will be prescribing the patient with what we call thrombolytics para malusaw ang blood clot, and then dili na siya magpadayon o move towards kung asa man na siya. That could cause further complications to your patient. Pwede siya magkaroon o kanang blockage sa heart kasi with that mamatay pa imo patient, or kung dili man sa mga pulmonary veins or pulmonary arteries imo, diba? So we are giving these thrombolytics. And then we also have medications such as hemostatics. So ano yung mga hemostatics natin? Okay, sa hospital setting, ginahatag din nato siya for patients who are experiencing signs of bleeding. Okay, yung ating aspirin, okay, yung ating aspirin that is considered as blood thinner. Okay, so yun siya. Meron pa bang question about sa difference between blood thinner and thrombolytics? Okay, remember your anticoagulants, iya lang palabnawon lang niya ang ato ang mga dugo. Okay, para dili magkaroon og buo-buo. Ang thrombolytics naa naman siya pre-existing na kanang tawag ani kanang emboli na clot sa sulod sa imong blood vessel. So ang buhaton sa imong thrombolytics lusawon niya. Okay, para dili na siya magsabay sa blood flow, para dili siya magkaroon og complications pa. Okay, mo na siya ang difference sa duha. Okay, so did I answer the question? Wala naman ni-reply ang nag-question sa ako. Sige, i-message na lang po kung naapa kay further kanang queries, kung nasabtan or wala. Okay? And hemostatic medications, okay, are medications that is given or is administered intravenously during emergency situation. That is to reduce possibility of hemorrhage because of ruptured blood vessels. Okay? Okay, para there will be, para dili na ta mag-abot sa point na it could cause death to our patients. Okay? So before we start, okay, I mean before we go on with our tawag nito, cardiovascular problem, let's first discuss the anatomy of your heart. Okay, just to refresh you with the anatomy of the heart. Okay, ang uban nakalimot na ani, okay? We all know that the anatomy of the heart, okay, the parts of our heart is composed of Okay, so our heart is composed of large vessels such as your superior and inferior vena cava, We have also your pulmonary veins. Okay, it's right and left pulmonary veins. Your right atrium. Okay, your pulmonary valves, your tricuspid valve, your inferior vena cava, your right ventricles, and then we have your aorta, your pulmonary arteries, okay, your left atrium, your mitral valves, your aortic valve, and your left ventricle. So this is the anatomy of your heart. Okay, I assume that you all know about this since you already finished your anatomy. But okay, just to continue about it. Okay, so we all know that our heart has separate pumps. We have your right and left separate pumps, but it is and it has four chambers. Okay, it has four chambers because we have your right and left. Okay, right and left atrium or atria, which is our receiving chambers. And we have our right and left ventricles, which are your discharging chambers. Okay. So, after having a brief discussion about the anatomy of your heart, do you still remember how does your blood circulation flow? Meron pa bang idea? Sige, kaya para dili lang si ma'am ang sige istorya. Sige. I will ask Grace. Grace?
Pwede ka nang shortcut lang, ma'am.
Oh, sige.
Magsulod ang blood, ma'am, paadto sa right atrium, gikan siya sa lawas.
Before siya sa right atrium, asa man na mag-agi ang imuhang blood?
Gikan siya sa body, ma'am, tapos dito siya mosulod paadto sa heart, sa right atrium.
Body talaga yan galing. Kumbaga sa system. O, asa man siya, bago siya makasulod sa imong right atrium, asa pa man una ag-agi ang imuhang tawag ani blood pasulod sa heart?
Dadi lagi ko kabalo. Call a friend.
Call a friend. Call a friend. Okay. Naay nag-answer. Sige. Naay nag-answer pa sa imuhang Grace.
Ay, sa superior vena cava.
Saan? Sa?
Superior vena cava.
Okay. Our blood goes inside our heart from your inferior and superior vena cava. Okay. And then from there, okay, Christine, thank you, Grace. Okay, Christine Ann Bretanya.
Po, ma'am.
Okay. Once your blood is already inside your superior and inferior vena cava, where does it go?
Yung sa right atrium po, ma'am.
Okay, very good. Because remember, your atrium serves as what? Ano nga yung sabi ko kanina? Your right atrium serves as your unsang klaseng chamber?
Receiving chambers po.
Very good. Okay, very good. It's your receiving chamber. So from inferior and superior vena cava, your right atrium will be receiving the blood from the system. And it will pass through where? What do you call? That door. Diba? Kanang murag door na opening para mag-pass ang imuhang ano.
Tricuspid valve po.
Okay, very good. That is your tricuspid valve. Okay? So, Faith. Okay.